examination, as usual, we start off with the IPPEC. First introduction, then we ask for permission, then our position should be on the right side of the patient, and then the exposure. The exposure for pregnant women will be from the nipple line until around the suprapubic area. Just expose a little bit of the pubic area lah, because we want to check whether if there is a previous C-section punya scar. And then last one is the comfort thing. Okay. We start off first with the inspection. Inspection thing, kalau nak senang ingat, tak adalah senang ingat pun. Just macam short form AUSVF for inspection of pregnant lady. A is for abdomen, U is for umbilicus, S is for scalp, V is for vein, and F is for fetal movement. What you see in the first in the abdomen part. In the abdomen part, of course, in pregnancy you see the standard abdomen, standard abdomen, gravid uterus. Then for pregnant ladies, you see two things. First is the linea nigra and the striae gravidarum. The linea nigra is located centrally from the umbilicus downwards, is like approximately about 1 centimeter width. Downwards is black chocolate color line, and then the gravidarum, as you know, is like horizontal line. And then next, the umbilicus. Umbilicus, we check the umbilicus whether it is centrally located or not. This is important because you want to check, you want to measure the SFH, the symphysis fundal height. And then we also check in the umbilicus whether it is inverted or flat. Okay, next, S for the scar. For the scar thing, we check if there's any previous C-section scar, the length of the scar, whether it is well healed or not, whether it is hypertrophic. This is important because we want to make sure it won't lead to the scar dehiscence. This scar dehiscence things, dia ada macam signs yang kita nak tahu benda ni akan jadi. So the short form will be SMAPPF. That is for me lah, kalau senang ingat. For the S is the scar tenderness. S is scar tenderness. Next is M. M is for maternal tachycardia or hypotension. Then the A is abnormal PV bleeding or any hematuria. Then the P is persistent lower abdominal pain. Another P is the progression of the labor will be delayed lah. Then the last one is the F is the fetal distress or bradycardia. Okay, next will be the vein. If we check the vein around the abdomen, whether you can see any distended vein. If there is distended vein, this is due to the IVC obstruction, compression. Sorry. Next is the fetal movement. Fetal movement for the primipara normally is from 18 to 20 weeks. The mother will feel the movement of the fetus. For multipara is 16 to 18 weeks. And when you check this, just in case if you cannot find the fetal movement, just don't simply write no fetal movement because it can indicate IUD. So that's all for inspection. Okay, for the palpation and the percussion. Just make sure. Normal lah. Okay.
Perfect shower.
Okay. First for the palpation, you softly palpate the abdomen of the pregnant woman lah. You check the 9 area, all the 9 area. We check for any scar or any swelling, any tenderness. That's all. And then next is we check the symphysis fundal height. The fundal height thing. So basically, if in normal pregnancy, the position of the fetus will be longitudinal, right? So when we palpate, we first start palpate laterally both of the hand and continuously upwards until the hand, both of the hand meet together. Then after meeting together, then use one hand, just do a simple line to check to measure the height. We use the measurement tape and just check from the line until the pubic symphysis. So basically, just normal reading lah for pregnant lady. Kalau macam kita ukur dalam about 30 cm the height. So we just plus 2. So the width of the pregnant lady will be 32. If 28 cm, so it will be 30 weeks of pregnancy. Somewhere like that. But if let's say in term punya pregnant, kalau dah maybe around 38 weeks, it won't be exactly 36 cm lah. It might be less because the fetus tu dah masuk dalam pelvic inlet. And one more thing, masa lateral palpation tu, let's say the fetus is slightly more to the right or to the left, simply just push it to make it, centrally located lah. Make it center. So easy for us to measure the fundal height precisely. That is for the symphysis fundal height. Okay, the significance of this fundal height thing, sebab kita nak tahu the uterus date comparing to the height of this thing or not. So kalau let's say if it is more, it can be due to polyhydramnions. If it is less, it can be due to oligohydramnions. Next is okay. The next thing is the palpation of the fetal part. Ni macam dia punya easy untuk ingat lah. Okay, first is the number, LPL and ELW. Number, LPL and ELW. Number ni number of poles lah. Kita check, kita palpate ada berapa poles kat dalam ni, whether it is single or multiple pregnancy. Next is the lie. Lie, it can be longitudinal, oblique or transverse. This is the longitudinal. In the longitudinal thing, if we palpate, if you can see if we palpate any presenting part, it can be cephalic or breech. If it is over the pelvic inlet area, so it should be the longitudinal thing. If oblique, the cephalic or breech will be either in right inguinal or left inguinal area. In transverse, cephalic or breech will be in the right lumbar or left lumbar area. Okay, that is for lie. Next is the presentation of the fetus. Presentation of fetus, it can be cephalic or breech, right? So when we palpate, basically if you want to know where is the head part or where is the breech part. The head part ada 3 benda yang memang kena ingat lah. Memang semua benda standardized semua. If head, it is hard, rounded and palatable. This is for head. For breech, it is lobulated, slightly soft and non-palatable. That is for presentation. Next is the location. Location of the fetus. Kalau dekat Ukraine kan, kalau if vertebra is this side, it is first position, right? If this side is second position. So in Malaysia, we use that. If we palpate, the vertebra is on the right side of the mother. So it is called facing the maternal right. Facing maternal right. If the vertebra is on the right side of the mother, that means on our left side lah. If we palpate from here. So if the vertebra on this side is facing maternal left, that is for basically longitudinal or oblique punya presentation. Kalau transverse